So I'm going to basically talk about OCD, obsessive-compulsive spectrum disorders. Okay? So obsessive-compulsive spectrum disorders is now a diverse group of disorders where the symptoms include repetitive intrusive thoughts, rituals, preoccupations, and compulsions. A patient with OCD can have an obsession, a compulsion, or both. So you must note that it is not always that a person with OCD will have a compulsion. Sometimes it is only an obsession. Sometimes it is only a compulsion. Yet both of them are classified as OCD. What is an obsession? An obsession is a recurrent intrusive thought, feeling, idea, or sensation. This is the definition of obsession. A recurrent and intrusive thought, feeling, idea, sensation. When you mean recurrent, you mean multiple times. So, for example, I have an obsession that my hands are dirty. It's a recurrent thought. My hands are definitely dirty. Even after washing, my hands are still unclean. So, it's recurrent. Why do we use the term intrusive? We call obsessive thoughts as intrusive thoughts because we know that these thoughts belong to us. There is no confusion there. Okay, they are not psychotic thoughts, which means that it is not that I feel somebody's putting this thought into my head. No, it is my thought, but it is intruding every other thought. Okay, so even though I'm doing something else, I will constantly have an intrusive thought which tells me your hands are still dirty. So by the term intrusive, you mean a thought that can intrude into other thoughts as well, and it is recurrent. That is an obsession. What is a compulsion? A compulsion is a conscious, standardized, recurrent behavior, such as counting, checking, or avoiding. So a behavior that happens, usually compulsion follows an obsession, but not always. Okay? So compulsion is the act, obsession is the thought. Obsessive-compulsive disorder. Now, patient with OCD realizes the irrationality of the obsession, okay, and experiences both the obsession and compulsion as ego dystonic. So they know that it is an unwanted behavior. They know that I don't want this. I don't like this thought. Unlike a psychotic patient who might even enjoy his thoughts and is very clear that these are not my thoughts, okay. So here the patient realizes that this is an irrational thought, okay. It is an ego dystonic experience. What is the difference between an obsession, a delusion, obsession, and an overvalued idea? So obsession has a subjective feeling of compulsion overriding an internal resistance. So typically obsession में एक feeling रहेगा that I need to do this. Okay, it is again a repetitive thought. It is an intrusive thought. I know that it is against my will. It is ego dystonic. It is absurd. There is a lot of resistance to it, but there is always a feeling of compulsion, and that compulsion is usually there is no resistance to this compulsion. You generally yield to these compulsions. Overvalued idea is not intrusive. Okay, it is a non-intrusive thought, and it is a idea that you pursue. It is an idea that you have accepted. Okay, but it is not intrusive. It is not a repetitive thought. Okay, so an overvalued idea can be that my neighbor is jealous of me. Okay, now my neighbor is jealous of me is not a thought that keeps coming to me regularly. It's not an obsession for me. If I keep getting this thought the whole day, the neighbor is really jealous of me, the neighbor is jealous of me, the neighbor is jealous of me, then it can become an obsession. Okay. Overvalued idea is ego syntonic. So I believe in that idea. I don't think it is absurd. And I think it is truly my idea. Okay. But the intensity is less than delusion. What is a delusion? Delusion is a false, firm, unshakable belief. So while an overvalued idea is my neighbor is jealous of me, but if my mother gives me an idea that no, she's not jealous of you, she's just having a bad day, that's why she doesn't talk to you. Why would she be jealous of me? I'm able to understand that. I may even question my thought. When it comes to delusion, you do not question that delusion. Patient is 110% sure the neighbor is jealous of me. They're doing things against me. There'll be a lot of elaboration also in that. They're jealous of me because I'm smarter than them. They're jealous of me because they don't have the kind of money, anything. Okay. So these three important type of thoughts you must know of. An obsession is a subjective, it's a repetitive, intrusive thoughts. Overvalued idea is non-intrusive and it is an acceptable idea. It is ego syntonic. Obsession is ego dystonic. And delusion, of course, has a completely unshakable conviction. Okay, right. Abhi current concept क्या है? Abhi current concept ये है that over the years we have realized that OCD, there may be many interrelated disorders that are a part of OCD. Okay, this is known as obsessive-compulsive spectrum disorders. Why do we call them a spectrum? Is because in terms of phenomenology, in terms of their clinical course, treatment, response, they have a common pathophysiology, they have a common genetic predisposition, and they often occur together. Okay. So again, like I said, they may be comorbid. Their insight can range from full insight to poor insight. Very similar brain circuits are involved, very similar demography, response to the same medications, very similar clinical signs and symptoms, onset of age is very similar, and the course is usually chronic. So, कौन से concepts हैं अभी? So, obsessive compulsive related disorders, if I talk about DSM-5, DSM-5 includes OCD, obsessive compulsive disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, excoriation disorder, and then substance-induced obsessive compulsive disorders, OC disorders due to medical condition, other and unspecified. So, इसमें आप चार बहुत important है that you must know that obsessive compulsive and related disorder, the term in DSM-5 includes OCD itself, the main disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, excoriation disorder. ये चार पांच नाम you must remember. Okay. So let's now first discuss OCD. I'll give